When most people think about cancer care, they think about physicians, nurses, and chemotherapy. But there's another member of the care team whose impact reaches nearly every step of the patient journey: the oncology pharmacist. Today, we're talking about what oncology pharmacists actually do, how they work with the cancer care team, and why their role has become so essential. I'm Amy DePue, and today I'm joined by my co-host, Aimee Faso, for a conversation about the role of the oncology pharmacist in patient care. When patients hear the word pharmacist, many may think of the person dispensing medications at a community pharmacy. While this is an important role of pharmacists, pharmacists do much more than that. Oncology pharmacists work with patients, the healthcare team, and organizations to provide optimal patient care. Amy is an oncology pharmacist, and today she'll help us better understand what oncology pharmacists do, how their role has evolved, and why they are such a vital part of cancer care. Amy, welcome.
Thanks, Amy. I'm happy to be here.
So let's start with the basics. What is an oncology pharmacist? And how is oncology pharmacy different from other areas of pharmacy practice?
So an oncology pharmacist is a pharmacist who has specialized training and expertise in the medications used specifically to treat cancer, as well as the complications that are associated with cancer and its treatment. But the role involves a lot more than just knowing the medications. So oncology pharmacists often work behind the scenes, and we're involved deeply in patient care. We work with all of the people involved in the cancer care continuum, from the time a treatment plan is being considered, through treatment, symptom management, supportive care, and some pharmacists are even involved actually in survivorship. We help make sure therapies are appropriate for the patient, safe to administer, and supported with the right patient education, monitoring, and follow-up. What makes oncology pharmacy unique is really the complexity of cancer care. So these medications have narrow therapeutic windows and can have pretty serious toxicities. So that can lead to more potential problems as far as managing patients. Treatments can have complicated dosing schedules, and there's also a very high cost associated with these treatments as well. So oncology pharmacists really are the medication experts within the field, where treatment decisions are happening very quickly, and medication management can have a direct impact on the outcomes and quality of life of our patients.
So when a lot of people think about pharmacists, they're thinking about those people behind the big tall desks dispensing medications. What does the day-to-day role of a specialized oncology pharmacist really look like?
Yes, we're involved in a lot of different practice settings, so it can look really different depending on that practice setting. But in general, oncology pharmacists are involved in both direct patient care as well as the behind the scenes, clinical support. So on the patient care side, our role involves reviewing multiple factors that are going to be involved for care. So that can include looking at diagnosis and lab values as well as organ function. We'll also take into consideration prior therapies and their medication list, and how all of these things can interplay when it comes to the proposed treatment regimen. We also counsel patients before they start, because it's important for patients to understand their treatment, how it'll be given or how they'll need to take it, what side effects are potentially could be a problem, and how to call for help when they need it. We also help manage supportive care, and that can include things such as nausea, diarrhea, pain, or other treatment-related complications. Now, on the system side, we're also involved with that too, and that can be verifying chemotherapy orders, and that can be things like checking doses, checking supportive care plans, looking at drug interactions, and really just participating in that treatment plan discussion. But also, we can also contribute to more institutional protocols as well, guidelines, and just processes that involve safety. So the role that we have is both clinical as well as collaborative with the other healthcare members of the team.
So from a former infusion nurse, I would have to say that the pharmacist role has changed quite a bit over the last couple of decades. Has the profession itself also evolved?
Yes. And as you know, historically, a lot of times our role was primarily through medication preparation, dispensing, and making sure that everything was safe. And those responsibilities are still necessary, critical, and important because safe handling of hazardous drugs like chemotherapy really remains one of our core functions. However, as you pointed out, our role has really expanded. So as cancer treatment has become more complicated, the pharmacist's role has become more involved to help with these complex treatments. So many oncology pharmacists work in different environments, such as ambulatory clinics or infusion centers, but they also work inpatient. They also work in investigational drug services, specialty pharmacies. And pharmacists can also have even a collaborative practice model where they work with patients along with a supervising physician. These things, I think, that really illustrate how complicated care has become is really illustrated with the increased use of immunotherapy, particularly CAR T. These types of treatments really require close-end management, and pharmacists really are playing a central role in the care of these patients. We're not only helping ensure that treatment is prepared and delivered safely, but we're also helping to make treatment decisions, manage toxicities, monitor adherence, interpret clinical evidence, even contribute to research.
So at what point in the cancer journey is a patient more likely to interact with an oncology pharmacist?
The pharmacist can really be involved at many different time points. So it could even be before the treatment begins so that we can help provide education in order to review that particular treatment. They can also interact with patients while they're getting infusions because problems can occur at that point. Patients who are on oral chemotherapy, pharmacists can be involved prior to starting and throughout their treatment regimen. When patients are admitted into the hospital, that can also be another point where pharmacists are involved. And that can be doing many different things, not just managing the medications themselves, but managing side effects and doing supportive care. So another important part that pharmacists can also be involved is when there are medication questions. And a lot of these questions come from patients, not just from the healthcare team, but pharmacists interact with patients in order to answer questions like drug interactions, dose adjustments, supportive care, and sometimes transitioning from inpatient stay to an outpatient stay.
What are some of the most important conversations that you have with patients and caregivers before treatment even begins?
For many patients, these treatments can be very overwhelming and they're not easy. Patients do need guidance. So we want to make sure that patients understand their medication. So why are we using it? How does it work? We'll go over how it's administered, what needs to be monitored. We spend quite a bit of time going through side effects. We want patients to know what is expected. What can they manage at home? What can you do to prevent side effects? When do they need to contact their team for urgent symptoms? So that's important that they understand that. Safe handling is also important if it's oral chemotherapy, and going over just practical issues like what if you miss a dose? So during that conversation, we're trying to reduce their anxiety as much as we're trying to educate. And I think that a lot of patients do feel that that really helps them and make a difference because they can feel now prepared to take their medication rather than overwhelmed.
One of the biggest shifts in oncology has been the growing use of oral anti-cancer therapies. They're all very effective, but they also have a place in our world that puts a whole lot more responsibility on caregivers as well as the patients. And so it makes it a little more difficult when they're trying to handle some of these things at home. So, what are some of the biggest challenges patients face when trying to stay on schedule with an oral therapy?
Yeah, you're absolutely right. When treatment was primarily IV, patients came and saw a nurse or a physician with every visit. But now we've moved that treatment at home. So now patients have to decide, is this a side effect a problem? There can be a lot of challenges. And really, some of them, not just side effects, but just really the complex dosing schedules with these regimens and knowing how to appropriately take them. Some medications have to be taken with food, some without food, and knowing those details is going to be important for them to take their medication so that it's safe and effective. So now this challenge has been to put that task to the patient rather than seeing us as often to help with those challenges. Some of the challenges are symptom related. So again, if a patient is experiencing something like nausea or diarrhea, they need to know what to do, when to call us in order to treat that symptom. And then other factors that really can play an important role, some of these we've addressed before, that can affect adherence is financial or psychosocial barriers. So things like high copays or having insurance delays, issues with transportation, these can all affect patients taking medications and being monitored appropriately. Adherence is really many factors, and it's important that patients have support, education, and the access that they need to take their medication consistently. And I think pharmacists really are in that unique position to work with patients in order to help them adhere to medications.
Well, we know that side effect management can really determine whether a patient is able to stay on treatment both timely and effectively, and even towards the end of treatment. How do oncology pharmacists help manage those toxicities?
Toxicity management is definitely another important way that we are involved in the day-to-day care with patients. So cancer therapies or even the cancer itself can have a wide range of adverse effects: nausea, vomiting, diarrhea or constipation, rashes, myelosuppression, or immune-related toxicities are just to name a few. And sometimes what we can do is we can help anticipate toxicities, and so that can help with patients understanding what to look out for, and we can recommend supportive care to help reduce those toxicities. Also helping identify side effects early so that we can help respond earlier rather than later. So this is another place where we can play a role. We may recommend antiemetic strategies or bowel regimens, supportive care, or just more close monitoring for patients depending on their situation. The important point is that good toxicity management is not in isolation, right? It's really about preserving the patient's quality of life, avoiding unnecessary visits, and really helping the patients remain on treatment when that's clinically appropriate. While this is something that is necessary from that multidisciplinary team, pharmacists definitely have an important role in that.
So I think that it's really important that when people are hearing and learning about the people on their team, and then they hear that, oh, there's going to be an oncology pharmacist involved, I think their minds probably automatically go to all that chemotherapy that it has been around for so long. And even with the addition of targeted therapies, they're still thinking treatment. But it's really important that the pharmacist is there for that supportive care. It's really becoming a major part of your role, isn't it?
Yes, it is. Supportive care is definitely a major role, and it's really inseparable from the treatment itself. While the drugs can cause side effects, so can the disease itself. And so patients need supportive care and interventions in order to stay on their therapy and stay safe. And this is an important part where pharmacists can be involved. That can include things like pain management, antimicrobial prophylaxis or treatment, and even things like growth factors to maintain blood counts so that they can stay on therapy. There's many different ways that pharmacists can be involved in the supportive care piece. I think for oncology pharmacists, it's really the full medication picture. It's not just the drug itself, but all the support that's needed to keep the patient on that treatment and for them to be safe.
One thing patients may not always see or understand is how their treatment team becomes such a collaborative process. I know how well you work with other team members, but I wanted to ask you, how do the oncology pharmacists work with the rest of the oncology team?
So, as you know, we're all talking, and it is always a back and forth conversation because we are definitely part of that multidisciplinary team. We work closely with the nurses and nurse navigators, which is so necessary, but the oncologists, the APPs, but even others such as social workers and staff in the infusion clinic, and also importantly, other pharmacists. A lot of times, some of these patients may have more than one pharmacist who's working with them, whether they're from a specialty pharmacy or another outside pharmacy, and we're talking to them as well. So we are embedded in the whole team. And so this collaboration can really happen in different ways. It can be during treatment planning, or it can be during supportive care and toxicity management, for oral chemotherapy monitoring, or for patient education visits. Also, pharmacists serve as the medication resource for the team. So we're helping to answer those drug-related questions that come up. So questions I get a lot is, what is an appropriate dose? How do I need to dose if someone has kidney dysfunction or liver dysfunction? What interactions are there and what do we need to do about it? And sometimes we're involved in the practical issues because there's so many things that can be involved on whether a treatment plan can actually be carried out. A lot of times we are looking at the whole picture in order to decide what is the treatment, what's the best way to dose that, and playing a role in how we're going to carry out the actual plan. While these are probably interactions that patients aren't seeing, but they are, of course, incredibly important for us to make sure, again, effective and safe treatment for our patients.
Well, since this series is also highlighting how different members of the oncology team work together, I'd love to hear specifically about the pharmacist-navigator relationship. How do oncology pharmacists work with nurses and nurse navigators?
We work very closely with the nurses and nurse navigators because, as you know, we've kind of pointed out before, a lot of times patients may be telling you, our navigator, first when they're having a problem. So you may be the first to hear about it, whether it might be a symptom or sometimes confusion, or you might assess, I can see that this patient's having challenges, even if they're not verbalizing it directly to me. Some of those challenges for the medication related pieces, that's when we can get involved to help. And it goes the other way too, because sometimes I'm talking to patients about their medications, but other problems come up, and that's when I'm going to be reaching out to you in order to help with those non-medication related issues. So there can be multiple things that patients can come up with. Like if they're on oral therapy, they may first tell the nurse or nurse navigator that they're having problems taking their medications or don't understand how to take them, or it might not even be affordable anymore. So that is when the nurse or nurse navigator is going to pull in the pharmacist to ask for help. It's really a complementary relationship, and it goes both ways.
As treatment options become more personalized and complex, there's a lot to consider before a regimen ever reaches that patient. How do oncology pharmacists contribute to treatment planning and evidence-based decision-making?
And this is another important area where oncology pharmacists can be involved, and they can review treatment plans and make sure that they're appropriate based on the patient's diagnosis and disease, what prior therapies they've had, their organ function. We must take into consideration their labs and comorbidities, and other very important patient-specific factors. But another role that we have is also looking at the plans and whether they're evidence-based, And so we can do this in many different settings. For example, I think pharmacists have a central role in precision medicine. This is becoming more and more a part of our decision making using genetic mutations in order to make treatment decisions. And pharmacists are playing a unique role in that. Pharmacists can also be involved with protocol development or even have collaborative practice agreements so that they can work directly with patients in order to manage medication. They are helping to apply the clinical evidence in order to care for the patient.
Well, safety is a very critical part of cancer care. What role do oncology pharmacists play in reducing medication errors and promoting that safe treatment delivery?
Yeah, that's a major role for our oncology pharmacists as well, because as you know, these medications are high risk. This is part of the workflow of pharmacists. We're determining that the treatments are accurate and appropriate for the patient. The other side is ensuring that the medications are being made safely, that they're handled safely, and that can include not only the physical making of the medications, developing policies, orders, being involved with pathways and quality improvement, because those are also the other things that we can do in order to reduce error. Treatment has just gotten to be more complex and there's many different layers involved. We can help with those layers in order to catch problems before it occurs and help to standardize care, because standardization is a way to reduce errors and administer treatment safely.
Well, medication access is another major challenge in oncology. So, how do oncology pharmacists help patients navigate issues like prior authorizations, high cost therapies, or treatment access?
Yes, this is always a huge issue, and particularly with our oral anti-cancer treatments or some of our newer specialty medications, their cost is very high. So pharmacists work very closely with the full team in order to help patients be able to afford medications. And that can be involved with financial counselors or other members of the team who help to navigate prior authorizations, looking for assistance or patient assistance programs. Oftentimes we have to be involved with appeals as well. Now, sometimes we have to identify other regimens or alternatives because of issues with the first treatment that was being considered, and that can be because insurance doesn't want to cover it or there's formulary restrictions. One thing that I haven't mentioned, but importantly, and sadly, sometimes we have to do this because of drug shortages. So those are kind of coming and going. And that's where a pharmacist can be involved to say, here's an alternative because what we would originally have used is actually not available. So we're helping kind of throughout this entire process, looking at where is the drug coming from, what to expect. Medication access isn't separate from patient care. It's really a part of it. If a patient can't obtain it for whatever reason, then the treatment plan can't succeed.
We've talked a lot about direct patient care and how the oncology pharmacist is a great contributor in so many different ways. I want to talk about some of the work that oncology pharmacists do in research, maybe quality improvement, the policy, and guideline development.
Yes, that's another role that oncology pharmacists have. It may not be that direct patient care, but it is very, very important. Oncology pharmacists can contribute or run clinical research programs. They can be involved with investigational drugs. They also can be involved with pathway development or quality improvement and institutional guideline development. These are all, while different roles, but have a very important impact on how we treat patients. For example, a pharmacist may help design supportive care protocols, and by standardizing these protocols, that helps ensure that patients are treated effectively and safely. Pharmacists can also be involved in other things such as informatics, computers, and data collection is really a large part of the full treatment, and pharmacists are often involved with that, looking at quality metrics, for example, so that we can use those quality metrics in order to try to have quality care applied to other patients. All this work is not as visible as like counseling a patient, for example, but it does have really a major impact on the safety and quality care of our patients.
And it's just another indication about how large that umbrella is that these patients don't even realize, recognize, but it is there, and the team is so much better for it. I want to talk now just a little bit about the future of oncology pharmacy. Cancer care is evolving, it's burgeoning. What was effective 3 years ago is no longer the key thing. So, with more targeted therapies and immunotherapy and cellular therapies and precision medicine, how do you see the role of oncology pharmacists changing over the next several years?
This role is just going to become more specialized, more integrated as treatments become more complex. So, really, we have treatments now that may involve patients taking a treatment regimen that involves IV and oral medications. Because of that complexity, we really need people who are experts in the medications that can take the evidence, help manage toxicity, support patients with adherence, and help coordinate all the pieces that are going to be required. I do think that we'll continue to see expansion of pharmacist-led services. We'll see expansion of collaborative practice models. Pharmacists are involved with practice models, but I think those will continue to expand. Being involved with precision medicine and even things like survivorship care, I think that that's an important role that pharmacists can play. And so maybe another piece where we can grow into. And then being involved with quality initiatives as well, I think is going to be critical as things become more complex. I think really the opportunity is simply we want to make sure that oncology pharmacists are being utilized within the teams. The value is there to help with planning, education, supportive care, safety, and access. But the challenge is just to make sure that the systems are all built to support the pharmacy practice. And we know that the multidisciplinary team is so important, and that pharmacist is really an important part of that team.
I'm wondering, could you share an example maybe of a patient situation that really illustrates all the great things that you've talked about?
I think of patients who are starting oral chemotherapy. There's a lot of things that patients have to balance when they have a new diagnosis and then have to start oral treatment. So that's where having that pharmacist to help review a complicated medication schedule, help patients anticipate and be able to know what to do when side effects occur, and dealing with the insurance barriers that can inevitably happen, and really trying to help with the anxiety that goes with this new diagnosis and new treatment. This is where I think the pharmacists can help make that more manageable for the patient, because they can walk the patient step by step, and they can be there when those questions or problems arise in order to help take them through that treatment journey. Sometimes these interventions can be really small, like education or just providing follow-up. Sometimes just a phone call may seem like something small, but it can actually make a difference between the patient feeling overwhelmed into feeling informed and supported.
If there's one message you'd want listeners to remember about oncology pharmacists, what would that be?
I'd say that we're more than just medication dispensers. We're really part of the entire medication cycle. I have always considered myself a patient advocate. That I feel is by going through the medications, managing side effects, ensuring adherence, navigating barriers, really working with the multidisciplinary team, we can really advocate for our patient so that they can have effective and quality care.
Today's conversation really highlights that oncology pharmacists are involved in far more than just the medication itself. They help guide treatment decisions. They educate patients and caregivers and providers. They manage side effects and supportive care. They improve adherence. They promote medication safety and work alongside the entire oncology team to help patients receive the very best care possible. Amy, I want to thank you for sharing your expertise today. It's been quite eye-opening and very valuable information.
Thank you. I so appreciate it.
And thank you for listening to Voices in Oncology from STO. To learn more, visit sto-online.org. Until next time, thanks for listening.
Voices in Oncology is produced by the Society for Translational Oncology, STO, for educational and informational purposes only. Content does not constitute medical advice and should not be used as a substitute for professional clinical judgment. The views and opinions expressed by guests are their own and do not reflect the official position of STO. Mention of any product, service, organization, or therapy does not constitute an STO endorsement. Clinicians should exercise independent judgment in applying any information discussed to patient care.